for the traditional lumbosacral manipulation, you would have them side bend toward the side that you're going to manipulate. It doesn't matter in terms of the clinical prediction rule studies which side you start with first, painful side, non-painful side. They do recommend you do manipulate the painful side first. You do 2 times each side, about anywhere between 2 and 4 treatments, as long as they meet at least 4 criteria. 3 criteria is a little bit less chance of success. 4 criteria, very good chance of success, improvements and resolution of complaints. So the variation that I teach, I think it's easier to do. So again, the patient in a class, their hands behind their head. You can side bend. If you put your fist down there, you kind of use as a fulcrum. You can side bend toward that. Have you, if you hook their heel on the outside edge of the table, that'll keep them in the side bend position. So in terms of holding the side bending, do you have to do it? That is the way it's traditionally taught. I haven't found that to be, you don't have to hold it 100% for it to be a successful technique. I don't really do this technique as often. I pretty much only do it at home because I don't have tables. So when I meet with my relatives or a neighbor or something, I do it at home. It's easier to do it on the flat ground. And I found, again, over the years, you don't have to hold as much of the side bending. If you want to hold the side bending, you start to rotate up toward, like that. So I'm trying to hold that. If you take your arm, you could also just pull them up. And I'm going to eventually interclasp this hand on the table to hold them up there. The thrust is delivered through here. It's on the iliac crest. So I typically have them exhale as they come up, and you want to bring them up until the iliac crest is slightly off the table. You want to mash this into the table. So you want a little bit of excursion of the iliac crest coming up off the table. Deep breath in, exhale, relax. This on, and then actually here, couple cavitation setup, and the thrust is like that. So typically with this one, again, you're not going to get an SI gap in people over the age of 17, 18. There's a lot of ankylosing that goes on there. Study shows not a lot of movement in the SI. Will you get cavitation on the thrust? Probably, but I find that most of the time you get cavitation actually on the setup. Whether it cavitates or not, you still do the thrust. You also do the other side.